the News Channel 5 network, this is Open Line.
Hello, everyone. Welcome to Open Line. I'm glad you're with us tonight. It is Wednesday, May 27th. Once again, talking about the coronavirus, a new sort of aspect tonight that we're going to delve into that's critically important. How is this situation impacting those experiencing homelessness, the homeless community? And there's a lot to discuss there. And I'm glad that we have with us, once again, via Zoom, being very responsible, social distancing. So our guests are joining us via Zoom. We have Paula Foster, who is the chair of Metro's Homelessness Planning Council. Paula, thank you for being with us. And Dr. Sheryl Fleisch. She is the medical director of Vanderbilt Street Psychiatry and Homeless Health Services. Dr. Fleisch, thank you also for being with us. And all right, so where are things right now? Obviously, those experiencing homelessness are going to be at greater risk for the coronavirus. How is the city handling that situation? Certainly, we've heard about how they're being housed. Some are anyway out at the fairgrounds. But Paula, I'll start with you. How is this impacting the homeless community? What is the city doing? We'll kind of take the big picture and work our way down.
Okay, so very much for this time. I hope that it's informative for your viewers and happy to take questions. So I am the chair of the Nashville-Davidson County Continuum of Care Homelessness Planning Council. We are formerly the Homelessness Commission. I was appointed originally by Mayor Megan Barry and then reappointed by Mayor Briley to serve on this council. Our function is to help to plan and implement policies that will help our city move toward ending homelessness. We're involved in helping to rank proposals for HUD funding, making sure that the maximum amount of dollars from HUD comes into our community to address the issue of homelessness and housing and rehousing and making sure people have the services and things that they need, particularly getting roofs over their heads, which is a particularly difficult thing to do. One of the things that has happened over the last few months is that clearly the city, every city, the world, was not prepared for this pandemic. And we are all left trying to figure out how to do things the best way we can with the time that we have. And so our city's response has been to make sure that there is a space for people who need to have shelter over their heads. And that is a good thing. The Metro Social Services and Metro's Homeless Impact Division is staffing that shelter along with some partners from medical facilities and other places. And they're doing a phenomenal job making sure that people have access to a roof over their head at the moment. And that's something that I can't stress enough. That is incredibly important that our city has done. I have some concerns about the facilities itself, but overall, I think that making sure that there's a place for people to be able to socially distance and keep themselves in relative safety when it comes to fighting this pandemic and this illness is important. And I think the city is responding to that in a positive way in many respects.
So, all right, how does this shelter work? It's out at the fairgrounds. I have some information on it, but I want to hear from you. There are 3 tiers to it. How does somebody get put out there? How does this shelter work? I guess give us the big picture on that.
So my understanding is, and let me be very clear from the get-go, that unfortunately the Homelessness Planning Council was not involved in planning for this response. This shelter was thought of and implemented and created by Office of Emergency Management, OEM, and by the Mayor's Office and by the Department of Health. They followed the minimum CDC guidelines for establishing a congregate shelter. And please don't let anyone tell you that it's not congregate, because it is. And so they decided that this was the best option that they had without consulting other experts in the field around it. So my understanding from the way that it is working is that initially it was established because the National Rescue Mission felt like they were not able to provide the appropriate kind of shelter for the number of people that they had. They were not able to socially distance in their shelter and asked the city for some help. And when that happened, the city then decided to open the fairgrounds. So they have 3 different sections of this. One is what they call the well shelter. You're sent to the well shelter via, so you go to the mission first, and then you're sent to the well shelter. The way that it is set up is the folks are grouped into groups of 25, and they are separated by corrals. Literally, the mobile gates that they use to line a parade route. Those metal that look like bicycle racks. Yeah, that's what they're separated by in that well shelter, and they have cots that are all 6 to 10 feet apart within that section for each 25, and those sections they eat together. They do all sorts of things in a socially distanced and very appropriate kind of way. That's the well side. If someone has a COVID test, they become a PUI, or person under investigation, and they're moved into the second tier, which is folks awaiting the results from those tests. In that particular place, they have separated folks into kind of individual 10 by 10 units that are separated by curtains that are kind of floor to ceiling curtains. And then from there, if you test positive, you're moved into what is the sick shelter. Also, the kind of 10 by 10 square that's separated by curtains and not the corral. And let me ask that is my understanding of the process.
Before I ask Dr. Fleisch here the next question, but how many people are out there right now? Do you have any idea how many people are out there at this moment?
I do not. I have, at one point they were at maximum capacity, and I honestly, I don't know what that maximum capacity was. They are not at maximum capacity at the moment. And I saw some information a few days ago, but I don't know what the current numbers are.
And now, Dr. Fleisch, you've been on the show before talking about homelessness. You were part of a documentary that was great, that was done by somebody on our staff here, and you were part of that. How you work closely with the homeless, and how have you seen the coronavirus impact that community, and how has it impacted the work you're doing? I guess talk to us about that.
Yeah, so as everybody knows, individuals who experience homelessness are going to be at greater risk of really all type of viruses. So folks who are homeless have a mortality that's significantly lower than persons who are not experiencing homelessness. So really, in all studies that exist, the average age of mortality in persons who experience homelessness is about age 50. So we don't have enough data yet to know exactly what the age of mortality will be with anybody who has coronavirus. But as Paula was saying, what we do know is that individuals who experience homelessness are going to have a really difficult time with sanitation, are going to have a really difficult time social distancing, and are going to have a almost impossible time following any CDC guidelines. So when we think about individuals who are already living outside, so in Nashville, we have, at least on the point in time count last year, about 2,300 individuals in Nashville who are experiencing homelessness, and a large proportion of those individuals are already living outdoors. A lot of those individuals are at risk of encampment sweeps and other things that can happen when they're already outdoors. And so a lot of the things that we see on the street, they're really still at risk of. So the CDC has placed recommendations so to not have any sweeps right now, to provide people with opportunities to have sanitation outdoors. So there are things that the community has tried to put into place outdoors, like placing sanitations at encampments, trying to provide outreach workers with PPE and other things. But as Paula was saying, those are so hard to get because society really kind of hoarded those things for themselves initially. And so persons experiencing homelessness had a lot of difficulty difficulty accessing those resources. So to answer your question regarding what are the barriers to care, the major barrier to care right now is persons experiencing homelessness trusting the hospital system, actually having a physical way to access the care. So the things that they relied on previously, like the bus system, well, it's impossible to basically socially distance there. So how are they going to actually access that? How are they going to get food when the outreach worker that they relied on previously could be a risk to them because they could be an asymptomatic carrier? So about 25 to 50% of people who have coronavirus at least are asymptomatic carriers themselves. So we're really struggling as a nation to determine like the provision of care for persons who experience homelessness, both outdoors and in sheltered environments. And it's really impacted how we're able to provide that care because we don't know ourselves whether we may actually be carriers. And so we really need to enhance the testing access. So to get rapid testing that's available at shelters and in encampments and in other things like that. And until we have that, we're really not going to know the extent of the problem.
I remember in the documentary, you were someone, you would go out to these, you would go to where they are, and encampments or whatever, you would go and talk to them and visit with them. Are you not able to do that? Or is there not the kind of outreach? It sounds like that's what you're saying. There's not the kind of outreach now that there was, but it also sounds like you're saying the CDC has said no sweeps. So at the same time, Metro can't come in and move everyone out of these encampments, which is always a controversial thing, right? So what do we have right now? We have lots of people, I guess, living potentially in encampments, and there's not a lot of outreach that can be done right now.
Yeah.
Is that right?
That's basically exactly it. So one of the other things that happened in Nashville, as you know, is that we got hit by that massive tornado. And then only a couple of weeks later, COVID hit. And so a lot of the encampments were really ruined only a couple of weeks prior to the tornado. So we saw encampments that had, say, 20 people, and then they went down to maybe 1 or 2 or 3 people, and they kind of, the sanitation in that area, for lack of a better way to say it, was very poor. Often, not only was it poor before, but then because of the tornado, it became really bad. And then within a period of just a couple of weeks, when coronavirus hit, the focus was elsewhere, and also due to the CDC recommendation, police weren't really sweeping the encampments any longer. And so some of these encampments that became very tiny are now humongous. So they're 60, 70, 80 people. And so now you have a lot of people staying in one environment, trying to socially distance. But then you also have outreach workers that are really trying their best to provide services to individuals. But then on top of all of that, the service that we're trying to provide them is through, let's say, telehealth. Well, telehealth is not something that individuals who experience homelessness have easy access to through like mobile devices or other things. So really, the opportunities that are available to the rest of us are not available to this population. And so it makes it exceedingly difficult. And I also think that it's really brought out the inequity that has always existed in this population and many other populations. It's now really shown it to the entire world. And now we're kind of finally seeing this.
So I'll ask both of you this. I'll start, Paula, I guess, with you. There were 100 people at one point that tested positive at the mission, at the rescue mission, and I'm sure they were moved out to the fairgrounds. What I'm hearing from Dr. Fleisch is that there are these encampments. Do we have a sense of how many people may be positive, testing positive at these encampments? Do we have a good handle on the positive or negative sort of nature of a test, a coronavirus test, how those people would test that are living in some of these encampments around town? And Paula, I'll start with you.
So absolutely not. One of the biggest issues that we have at the moment is, so we've set up this shelter for socially distancing these are folks that would have come to the mission, to seek shelter at any given time. There's a lot of people who won't go to the mission to seek shelter, and it just continues to grow. And with all of the things that have happened with this pandemic, people who are losing their jobs, they find themselves in housing instability, and some of those folks are ending up on the street, living in cars, living under bridges, and some in the encampments. And Dr. Fleisch is right; those encampments have grown. Let me be very clear: there are some incredible organizations, nonprofits, along with the city's Homeless Impact Division, who are continuing to provide services to those folks in the encampments. They're going out. Neighborhood Health is doing a great job trying to get into those camps to make sure that there is the opportunity for testing. And there's a possibility, they're working on doing rapid testing in the encampments. So that's going to help, and I don't know where we are in the implementation of that. Again, unfortunately, there seems to be a lack of communication and transparency from this administration on what the city is doing when it comes to those kinds of things. And the Homelessness Planning Council has, as of today, sent a letter to the mayor with recommendations and requesting that we be part of the process, figuring out how to make sure that those folks in the encampments are getting the services that they need, that they're getting tested, that they're getting the sanitation that they need. All of those things we need to make sure are happening, and we're not sure that they're happening at the moment. We actually, when the Safer at Home order was issued, there was all of the, there are ordinances against, being able to do meetings electronically, public meetings. And so the governor's order, suspended that. And so councils and commissions were able to continue to meet if they had essential business. We were told by Metro Legal that we didn't have any essential business to conduct, so we didn't need to meet. So we heeded that advice and did not meet in April. We had just met just before this happened in March. And then by mid-April, we realized that what we expected the city to do, we were concerned that those things weren't happening and people were not being utilized in terms of their expertise to help set up the city's response to homelessness. So we've asked the mayor to be part of that planning process so that we can talk more about not only what do we continue to do right now when it comes to COVID, but what do we do long term. I think we all know that despite how much we want this to be over and for us all to be able to get this room together again, that's not going to happen for a while. The question becomes how much longer do we do this? And then how much longer can the fairgrounds continue to stay open as a home shelter? And no one seems to have answers to give us to that.
There was someone who was arrested when they left. I don't know if I think they were charged with breaking out. I think the person later said that he was unaware that he was being detained, but he was arrested for leaving without permission. What did you think about that?
Well, do you want my politically answer? Or do you want me to tell you what I really?
I want what you really think.
I thought it was the most ridiculous thing that I ever heard. Here's my problem with that. All across the country, whenever there's a quarantine issue and someone is placed in quarantine, they're told if they break quarantine, they could be arrested or fined. And that's across the board for everyone, whether they're homeless or not homeless. The problem that I have with what has happened here is that these folks were given quarantine orders. They signed them. They were told they had to stay at the fairgrounds shelter. My question is, did they understand exactly what that meant? Were they given any services that would help? I mean, can you imagine someone who has a serious and persistent mental illness or addiction issue being told that they can't go outside and leave the premises and they're stuck in a 10 by 10 curtained enclosure? There are issues around that I don't know that the city was prepared to deal with. And so someone left. And he was charged with initially, and I'm not sure where this stands at the moment, but he was initially charged with escape from a penal institution. My question for the city is,
you're breaking up just a little bit, but it's clear you were upset by that. Yes, he was. He was charged with escaping from a penal institution. He was bonded out by some people that were also concerned by all of this. And I'm going to ask you, Dr. Fleisch, then we're going to go to break. We'll start taking some calls. In that documentary, you were going out to these encampments quite often. Are you still able to do that? Is it all telehealth now? Are you still able to go out to these encampments? Have you been able to go out to the fairgrounds? And do you think, well, I guess, what have you been able to do since all of this happened? And that's for Dr. Fleisch. Now we're going to take a break. So we're going to take a break. If you want to call in, there's the numbers on the bottom of the screen, 615-737-PLUS, 615-737-7587. We'll get back to both of our guests, and we'll hear from you. Take a break. Be back right after this.